So this is the elbow CPM. There's a couple things to keep in mind when you're setting this up prior to the patient. You're going to need a couple cords. This one here runs from the motor of the machine down to the controller box. Then this is your patient activation cord for start and stop. And you also have your power cord. The main power switch to this is located here. It's illuminated. The device is on. And this is also your speed button here. So this is faster. This is slow. It uses the tortoise and the hare. So hopefully that's a universal language for everybody to use. So when the device is on, what we're going to do is we're going to get the patient set up in the bed. And so when you set them up in the bed, you're going to make sure they're comfortable in the bed, because they're going to be using this for several hours a day. So get the patient in a position where they're going to be tolerating the CPM for several hours. And initially you're going to want to bring the machine up to them and have them put their arm in here. The main thing is you're going to want to have their elbow at the fulcrum of the CPM machine. Right now it is not. And so we're going to try and bring the patient a little more towards the edge of the bed, typically what they need to do. Okay, and you can slide the machine underneath the bed farther and rest his elbow in here. The other idea is you want to make sure that the tricep of the patient is in line with the humerus bar here, and it's resting comfortably on this metal bar. We can adjust that so the patient's tricep is comfortable there. Go ahead and take your arm out of here. And you want to do that while the patient's arm is out to adjust this. You can adjust the machine by raising it here. You can also change the pitch of the device, which is going to change the attitude here. Release this, you can bring it back, or you can tilt it forward. We can also change the pitch of the machine from left to right. So this will slide in this position or back here. And when you're moving it from left to right arm, that would be an important part to have that done. Go ahead and put your arm up in here, Sean. And so right now what it looks like we have is his tricep resting comfortably on there. The other thing you want to check with the patient is make sure that they're comfortable in the device and that their shoulder is not being raised to get into it, or they have to lower their shoulder to get into it. You want them to be able to rest comfortably because they're being up for several hours.
It's a little high.
It's a little high. Okay. So what we'll do there, we'll start here. We'll just bring the machine down a little bit.
That's a little low. Maybe a little bit back.
Right there. Okay. So just make sure all these knobs are tightened after you're done. And make sure that the electronon is down in the fulcrum of this device. I think you could probably come a little bit farther into the machine. Very good. These straps come over the top of the arm. I'm just going to put these here unsecured for right now. And we have a pad that goes over the top of the forearm. And we can secure the pad here. This is where most of the pressure from the CPM is going to occur, is when they go into extension, is going to be on the forearm. This is another strap that comes over the top of the bicep. Typically when the patient is in this device, this strap here will help prevent them from wanting to raise their elbow or their shoulder up as it goes into extension. To change the range of motion, the range of motions are on this side of the device where you can see the numbers.
Oh, there we go.
There we go. And that is obtained to change the range of motion by a set screw, which is here, and the locking screw. So the further these are apart, this is up towards the end here, and this is down towards the very bottom, it achieves more range of motion. The numbers are on the indicator here with 0 to 135. And you also have a goniometer here to watch as the patient is going through range of motion. Once you have the patient in the device, this is the patient activation switch. You press it once and that will start the machine. If you press it again, it will stop the machine. If you start it one more time, it's going to reverse the action. things to watch out for when the patient is in the device is this pronation, supination handpiece. In the most common places where you're going to run into issues is when the device comes into flexion. And when it comes into flexion, the fulcrum is not always the same on the device here to this handpiece as it is from the patient's actual fulcrum to their handpiece here. So you'll have to watch this piece that goes into the thumb and may need to make adjustments to lengthen this as it comes into flexion. Are you okay here so far?
I am. Now it's starting to
Okay,
get,
so now it's starting to make a little impingement into his thumb area. We're going to simply release the switch, these knobs, and lengthen this just enough. So that he has room in his thumb area. When that happens, when he goes into extension, this piece may only be at his fingertips as it comes down into extension. The other things you want to watch out for is this into the patient's head. More common, we have to watch out that for when they're actually in their house because they're in a seated position, because the higher they are raised, the closer it's going to come to this patient's head. When they're lying down, it's a little easier. Oop. One more spot to watch out for is when the device comes into extension is if the patient is lying actually flat, you have an indication for this to hit into the bed, the mattress. So that's another area to watch out for. The main thing is though to make sure the patient is comfortable in the device, their tricep is resting comfortably and flat on the this piece here, and that there is not a tension on the collateral ligaments, either, I don't know what you would call this position, either left or right. So.
And this is Abby, Dr. Della Rocca's nurse. She's going to be helping us set up the paperwork for these folks to get a CPM at home. So what's going to happen is that Dr. Della Rocca's team is going to be sending paperwork to these guys when folks need an elbow CPM at home. They're going to actually go to the patient's house after discharge and set up the machine for them. But we're going to have a card for them at the desk so that you can alert them when your patient's going to be discharging so that they can make sure to visit them at home and get that set up for them. Anything else, guys?
Nothing else from our standpoint. So if you have any questions, please give us a call.
Sounds great. Thank you.
Thank you.